A very good morning, everyone. Thank you so much for joining our webinar today. This is in conjunction of World Cancer Day. And the theme for the World Cancer Day is to close the gap in care. And with that, we will be speaking to the patient navigation team here at Cancer Research Malaysia and looking at their efforts and how they're closing the care gap. Okay. So this is the agenda for today. Introduction of the patient navigation program. Interview with Olivia, a nurse navigator from the patient navigation program. Recap of the interview in English because the interview with Olivia will be a BM. So no worries if you don't understand, no worries. I will actually do a recap in English. And how can you support us? I have someone that just raised their hands. I'm not sure why. If there's anything, you can just drop it in the chat box. There's a chat box and there's a Q&A box. Thank you. Okay. So at Cancer Research Malaysia, we're not only doing groundbreaking research, but we also aim to close the gap in care between the rich and the poor, which means we want access to life-saving cancer treatment and cancer care, which is equal for all, no matter who you are and where you live. Therefore, we have Malaysia's first breast cancer patient navigation program established in collaboration with the Ministry of Health Malaysia, currently in 4 state referral hospitals across Malaysia. And here's a short video of the patient navigation program. It will give you a good introduction of the patient navigation program, what they do, how they support cancer patients, breast cancer patients.
Every cancer patient deserves an equal right to be a survivor. Survival for cancer has increased from 1 in 4 patients 50 years ago to 1 in 2 today. This is only true in high-income countries, and it only happens if you can afford the treatment. 70% of deaths due to cancer today occur in low and middle-income countries, and by 2030, 85% will occur in the similar settings. This is happening here in Malaysia. Barrier to care is especially prevalent for people who live in rural areas, as cancer centers are mainly found only in major cities. Travelling for cancer treatment to a major city can take anywhere from several hours to a half day, if not longer. A lot of people, especially from rural areas, do not have the means to reach these centers and may die without receiving any cancer treatment.
The Pink Ribbon Centres function as a one-stop centre that aim to deliver patient-centred care to newly diagnosed breast cancer patients to have timely access to diagnosis from symptom recognition to completion of treatment. Our research has shown that fear of cancer is a major factor that prevents patients from seeking early medical attention for diagnosis or treatment. We found the patient from low-income household has complex needs, face barrier to cancer care, and experience challenges in completing recommended treatment. The integration of patient navigation program to breast cancer patient management has improved the adherence to follow-up, address barriers, reduce the defaulter rates, and improve the quality of care. With the integration of patient navigation program, we have improved the coordination and strengthened the referral pathways from the primary care team. Diagnostic timeliness is critical in order for patients to receive life-saving treatment. Patient navigation program has also enhanced its overall adherence to follow-up, recommended treatment, and decreased cancer-related distress. We are looking at spreading our wings to more state referral centres in Malaysia that could deliver the similar services and benefit to the wider population of Malaysia.
In patient navigation program, we have developed a mechanism that not only enables the navigators to identify but also address the barriers to cancer care that could possibly interrupt the completion of treatment. Through the patient navigation program, we support patients especially from the lower income household in terms of transportation and treatment costs. Delivery of groceries can also be arranged to ensure they have nutritious food while recovering from their treatment. We also deliver emotional support by giving them a follow-up phone calls to check on their progress, post-treatment side effects, reinforce health education, identify changing needs, and ensure they do not miss their upcoming appointments. As navigators, apart from delivering care at clinical setting, we find the home visit enable us to understand the reality faced by patients at home. Besides patients, we get the opportunity to engage the caregiver and family members who plays important role in patients' journey. Our breast cancer patients need your help because every cancer patient deserves an equal right to be a survivor. Your kind contribution today will bring us closer to closing the gap in survival for our breast cancer patients.
So I hope this video has given you an overview of the patient navigation program here at Cancer Research Malaysia. So from our observation, from the PNP's team observation of their breast cancer patients, they noticed that many women fear of losing their breasts as part of their treatment. They fear because the fear of losing a crucial part of the body image. As part of the program, the PNP team will ensure patients are empowered with right knowledge and guided through the process of recovery that includes understanding what matters to them. Patients who have completed their surgery and their oncology treatment, meaning their cancer treatment, will be guided for the post-mastectomy bra and breast prosthesis breastfitting. The product usually needs to be purchased out of pocket, and it remains to be challenging for patients coming from low-income household. Today, Olivia, a nurse navigator from the Patient Navigation Program at Cancer Research Malaysia, and she's based at the Pink Ribbon Center and Hospital Queen Elizabeth II, Kota Kinabalu, Sabah, she'll be sharing with us her experience in organizing a post-mastectomy bra and breast prosthesis fitting session with women who have underwent mastectomy and completed their treatment. As a navigator, Olivia has held hands and seen the painful tears of breast cancer patients receiving this product that has made them to be hopeful, which also increases their self-confidence. So here's the video of the interview.
Good morning, Olivia. Thank you for joining us from Kota Kinabalu, Sabah. Olivia is actually a nurse navigator from the Patient Navigation Program. Olivia, sihat pagi ni?
Hai Wisla, iya sehat. Thank you sebab beri peluang saya untuk sharing tentang pengalaman hari ini.
Okay. Olivia, saya nak tanyakan, bagaimana PNP membuat perubahan selaras dengan tema Hari Kanser Sedunia tahun ini, iaitu merapatkan jurang penjagaan. Or in English, we call it closing the care gap. Macam mana PNP program membuat ini?
Okay, yes Wisla. Tema kanser sedunia selaras dengan visi kami di Pusat Navigasi di Sabah. Dalam program navigasi, kami akan memberi panduan kepada pesakit yang baru mendapatkan diagnosis kanser payudara untuk mengatasi cabaran dan sempurnakan rawatan yang telah disyorkan oleh dokter.
Okay.
Cara pasukan navigasi merapatkan jurang penjagaan adalah first, kami akan mendapat siasatan diagnosis pada masa yang tepatlah. Misalnya kata, pasien akan direfer dari klinik kesehatan ke Hospital Queen 2. Di sana, first pesakit akan datang di klinik ini, kami sebagai navigasi akan temu bual mereka lah. Kenapa kita buat itu? Kita ingin mengenal masalah mereka lah. And then selepas itu kami akan dokter di sini akan membuat triple assessment. Apa itu triple assessment? Itu adalah ultrasound, mammogram dan pengambilan sampel biopsi.
Okay.
Selepas itu pesakit yang sudah tamat untuk membuat rawatan, kami juga akan memberi pesakit pengetahuan lah tentang perjalanan kanser payudara, dan kami akan memberi pesakit memberitahu semua macam mana mereka akan menjalani perawatan mereka nanti.
Okay.
Okey. Ini karena kami ingin kurangkan keciciran di kalangan pesakit kami. Kami ingin mengenal siapa pesakit kami, mereka datang dari mana, apakah sumber yang mereka ada, dan bagaimana situasi mereka selepas diorang didiagnosis kanser payudara.
Okay.
Okey, selepas itu kami akan tingkatkan sistem sokongan pesakit lah. Kami akan memberi mereka counselling melalui doktor di sini, navigasi, dan kami akan counselling family member pesakit, ataupun kalau mereka macam tidak yakin lagi, kami akan refer pesakit kepada survivor kami lah. Kami ada support group di Sabah, dinamakan Kinabalu Pink Ribbon. Mereka adalah
Okay.
survivor kami.
Okay. Jadi support yang PNP program ini dia bagi dari semua aspek. You bukan saja membuat saringan, they have to go at triple test ke?
Iya, betul.
Triple test, and then you also nak mengenal pasti siapa yang your pesakit, sebab you nak tahu macam tadi Olivia share, you nak tahu sumber mereka dan what are their resources, you nak tahu macam mana emosi mereka apabila mereka mendapat tahu mereka ada kanser payudara. Dan bukan saja tu, you also connect them to the cancer survivor group Pink Ribbon Kinabalu, correct?
Kinabalu Pink Ribbon.
Yes, Kinabalu Pink Ribbon, sorry. So it's interesting kan, yang dia dari all aspect, the patient navigation team is trying to support or is doing their best to support this women who have gone through breast cancer. They're going through their treatment. So Olivia, I nak tanya you, baru-baru ini CanCare mengadakan sesi dengan anda dan yang lain dalam pasukan PNP mengenai pemasangan bra prostesis. Bolehkah Olivia share sikit tentang pengalaman Olivia going through that training? Apa yang berlaku, bagaimana ia berbeza?
Ya, boleh. Okey. Tahun lalu 2023 Cancer Research Malaysia telah mendapat dana dari LDS untuk membiayai pembelian post mastectomy bra yang khas untuk pesakit yang telah menjalani pembedahan mastectomy lah. Kami telah mendapat dana lebih kurang 100 lah untuk pesakit dari golongan yang kurang berpendapatan rendah. Dan tahun lalu kami telah berjaya mendapatkan 49 pesakit, yang selebihnya untuk ni tahun kami akan mula mengumpul data balik untuk pesakit lah. Okey. Kepentingan post mastectomy bra dan breast prosthesis ini, setiap pesakit memerlukan post mastectomy bra selepas pembedahan supaya mereka dapat mengekalkan keimbangan leher, dada, dan tulang belakang. Secara langsung dapat mengekalkan dia punya postur badan dan badan yang seimbang lah. Lepas tu pengukuran untuk post mastectomy bra selalunya disyorkan selepas menamatkan pembedahan ataupun rawatan di onkologi di bahagian di onkologi lah. Derang post kemoterapi ataupun radioterapi. Sebab
go ahead.
Sebab kalau lepas pasien dari radioterapi, derang punya kulit akan terkupas-kupas dan ada yang sunburn lah. Derang tidak selesa untuk pakai bra.
Okay. Jadi, okay, Olivia nak tanya kan, yang this is post-mastectomy bra lah, which is called the prosthesis bra kan? And this is the silicone, yang tepi tu silicone,
Ya, betul.
correct? And here's a picture of the silicone going into the bra. Tapi macam bra biasa pun ada ni kan, tapi the difference dengan silicone ni, you kena measure the woman's breast first sebelum buat silicone ni, betul?
Ya, betul. Kita kena ukur lah payudara pesakit. Kita kena ukur dan kita kena ajar pesakit macam mana cara penjagaan dan pemasangan ni bra di bahagian payudara mereka.
Okay, so dia sebenarnya custom made lah. It's not something yang you boleh beli pergi ke kedai dan beli kan?
Iya, tidak.
Okay. Jadi tadi Olivia share tentang this particular prosthetic bra ni for 100 people which dia is sponsored by LDS. Ada tak cara-cara lain yang woman boleh dapatkan prosthetic bra? Mungkin dari Jabatan Kebajikan, boleh ke?
Iya, boleh. Bagi pesakit yang bekerja di kerajaan, kami akan selalu kami refer bahagian derang punya JPA, iaitu Jabatan Persekutuan Am. Kami akan refer bahagian itu. And then bagi yang pesara, JPA pesara lah. Tapi bagi pasien yang tidak bekerja dan berpendapatan rendah, kami akan refer bahagian Majlis Kanser Negara lah, ataupun kita punya support group Kinabalu Pink Ribbon.
Tapi itu semua kena wait pun kan? Dia bukannya it's not that you get it easily lah. Ada time dan jangka masa yang kena tunggu kan?
Ya, even kalau JPA, under JPA 3 bulan baru ada kelulusan lah, selalunya begitu.
Ya, and bukannya apa, tapi mereka pun ada banyak patients yang tunggu untuk berprostesis ini kan?
Ya, betul, ikutan.
Okay, and nak tanya, berapa harga berprostesis ini dan adakah ia mudah didapati?
Ini berprostesis ini susahlah didapati sebab harga dia pun di beberapa syarikat Malaysia dan informasi harga pun ada berbeza-beza. Tapi selalunya kami harga produk ini dalam lingkungan 1,350 hingga 3,500 lah. Dan kami telah berjaya bekerja sama dengan KNK dan satu set bra dan juga proses berharga RM1,350 lah.
Jadi sekarang kita kena faham lah kenapa kalau even if they apply dari mana-mana jabatan or yang macam tadi Olivia share yang tak kerja that ada sejabatan you all apply from kan, dia kata kena tunggu macam 3 bulan atau lebih. Sekarang kita faham sebab bra prosthesis ini memang mahal as compared to normal bra. 1,300 to about 3,000 ringgit, which is very expensive. Lagipun ini untuk it's much more for people from the low income community, right? To be able to afford this. Okay. I see. So tadi nak tanya, okay, berapa ramai wanita yang mendapat manfaat daripada pembiayaan ini?
Sekarang yang tahun lalu ada 49 orang lah. And then yang selebihnya kami tengah kumpul data untuk tahun ini.
Okay. And normally dia bila Olivia kata kumpul data, you nak tahu kalau mereka dalam if they are from the low income community lah, and macam dia kena satisfy ke apa-apa kriteria?
Iya, perlu. Yang kami kena itulah patut interview pasien dulu lah, yang betul-betul memerlukan lah. Kami kasih duluan mereka.
Okay. So you need to see siapa yang need first, then you give them. Because tadi pun Olivia share kan, there is a lot of benefits nak pakai prosthetic bra, macam physical issues, posture, untuk mengendalikan back pain, and emotional issue is like confidence and so on kan?
Betul.
Okay, nak tanya ada apa testimoni dari patients yang Olivia boleh share dengan kita selepas menerima bra prosthesis ini?
Ya, ada beberapa kami dapat WhatsApp dari pesakit lah yang mereka sangat berterima kasih dan sangat bertuah mendapatkan manfaat ini, dan ada juga yang sangat cakap yang derang sangat dengan adanya ni brand, derang confident level mereka lebih okey daripada yang dulu.
Lebih baik daripada yang dulu lah, confidence mereka. Boleh tak, because Olivia went through the training, Olivia pun yang memberikan, selepas going through the training, Olivia met this group of women who has gone through mastectomy, and Olivia trained them how to wear this bra, and you gave them the mastectomy, the prosthetic bra, right? Apa perasaan mereka apabila mereka menerima bra tu?
Okey. Selepas ada satu pesakit kami, selepas dia menerima ni bra protesis, dia sangat terharulah. Dia duduk dan tunduk dan dia menangislah. Di sana dia bercakap, sebelum ni saya hanya menggunakan bra biasa yang diisi dengan span dan kain saja. Sekarang saya mendapat bra yang sebenar dan saya sangat-sangat bersyukur dan berterima kasih. Dia bilang. Lepas tu kami kasih sabar dia lepas dia menangis lah.
Yeah. I mean,
Yeah.
it is lah. Sebab kan a breast is a important physical structure for women kan, and it plays a very important role. And bila this group of women, they don't have their breast and they cannot pakai bra yang biasa, we can only imagine macam mana confidence mereka. So now with this bra, her confidence will also increase, kan?
Betul.
So
Yeah.
Olivia nak tanya, selepas pengalaman ini, macam you said that one patient was crying when she received the bra and she was very, very thankful. Ada apa-apa nota terima kasih kepada LDS? LDS ialah Latter Day Saints Charities yang menaja bra-bra ni. Jadi apa nota terima kasih kepada mereka?
Okey, saya sebagai wakil pesakit dan staf Pink Ribbon Center HQ itu dan Cancer Research Malaysia yang menerima manfaat ini sangat-sangat berterima kasih kepada LDS. Tidak semua tahu betapa pentingnya dan bermakna bra protesis ini kepada wanita yang sudah membuat operation mastectomy untuk meneruskan kehidupan seharian mereka. Mereka juga pernah kehilangan keyakinan setelah kehilangan payudara mereka. Pepatah payudara mereka adalah macam harta yang paling bernilai bagi mereka lah.
Correct.
Akan tetapi dengan adanya manfaat dari LDS ini, bagi pesakit yang tidak berkemampuan mampu berhias dan lebih yakin keluar dari rumah tanpa berasa malu dan takut lagi. Sekali lagi kami mengucapkan terima kasih.
Thank you, Olivia. Thank you. I mean, I also like to thank Latter Day Saints Charities for sponsoring this bra for this group of women from the low income community. Sebab, like Olivia ada share kan, ada yang menangis sebab they finally feel like a woman again, which is very important. Only bila mereka feel macam themselves back again, that's when they'll be happy kan, and it definitely increases their confidence level. And kalau Olivia tak share story ini, macam some women dia pakai bra biasa, dia terpaksa masuk sponge, dia terpaksa masuk kain, people who are listening also wouldn't know about it, kan? And they will think macam bra kalau mereka go through mastectomy boleh pakai bra biasa apa, sebab kan ada shape. Tapi dia lebih dari itu, kena pakai the silikon dalam, and there is a reason why. Sebab it's to protect from the posture, giving them proper posture, sakit belakang, and also like you said, is to give them the confidence. So nice to hear that the story behind why this is important, and it's nice to have Latter Day Saints Charities to sponsor this. Okay, thank you, Olivia, and I would like to wish all the best to the PNP team, and for you all to continue doing great work. I hope there'll be more support coming your way. Okay, thank you, Olivia.
Thank you, Bisla, so bagi peluang untuk share pengalaman ini.
Sure, thank you. Good morning, Olivia.
So that was a short video or the interview with Olivia, the nurse navigator from the patient navigation team. As I promised you earlier, I will do a short recap of the interview earlier because it was predominantly done in Malay. So during the interview, I asked Olivia, how is PNP closing the care gap? And this is what Olivia said. She said the PNP team give guidance to those who just got diagnosed with breast cancer to overcome their challenges and struggle to ensure that they undergo their treatment that was advised by the doctor smoothly. The PNP team will interview patients that are referred to them to understand their problems, and the doctor will do a triple assessment. What is a triple assessment? It includes ultrasound, mammogram, and a biopsy will be taken. PNP team will provide information to breast cancer patients on how they will go through their treatment. And in order to avoid defaulters, people defaulting the treatment, not being compliant, they will gather information on who are the breast cancer patients, where they come from, what are the challenges or issues they face, their financial resources, and their situation after being diagnosed with breast cancer. So what I mean situation is their emotional state after being diagnosed breast cancer, because it will take a huge toll on the patient. So this is how PNP team is playing different roles, ensuring a proper journey for the breast cancer patient, that they go through their treatment and complete their treatment, therefore improving survival. Besides that, the PNP team will also support the patients by giving them counseling. They'll also give their families counseling. Why is this important? Because when a patient is affected, the family and the environment they are in will also get affected. So it's important to give moral support to their family as well. And if they see that this patient needs more help, they will refer this patient to the survivor group, such as the Kinabalu Pink Ribbon. So earlier, we spoke with the post-mastectomy bra. So what is this? It's a breast prosthesis that is an artificial breast shape that sits inside your bra to replace all or part of your breast. You use a prosthesis after you have a surgery to remove the whole breast, which is called mastectomy. Mastectomy is basically removing the breast. Okay. Lately, CanCare, which is a company, did a session with Olivia and the others in the PNP team on prosthesis bra fitting. Olivia explained they got the funding from Later Descents charities for 100 women to get prosthesis bra who come from low-income community. Last year, they managed to give out the bras to 49 women, and the remaining will get their prosthesis bra this year. So what are the benefits of this post-mastectomy bra? They need to they need the bra after the surgery because to maintain the balance of their chest, neck, and backbone. So there's a scientific reason why this bra is important. This will also ensure they can maintain a proper body posture and help with their confidence level. So there are many reasons why this prosthetic bra is important, and it's just not like a bra to just wear a bra. There is a scientific reason to it. So this is the post-mastectomy bra, and this one is a silicone, the insert. Okay. The specific measurements for the post-mastectomy bra is advisable after completing the surgery and treatment, as in post-chemotherapy or post-radiotherapy. Here's a picture of the prosthesis or the silicone that is inserted into the bra pocket. As women who are listening today, even normal bras, we have this pocket to insert the bra padding. But in the case of women who underwent surgery to remove their breasts, they need to measure the woman's breast in order to make the silicone. So it is therefore custom made, and it's not something that you can easily get in the shop. The custom made silicone is inserted into the bra pocket. Okay. The bra prosthesis is not easily available as only certain shops carry it, and the price range can be anywhere between 1,350 to 3,500. For this project, we worked together with CanCare and managed to get the bra for 1,350. These are some of the patients who received their mastectomy bra. The bra is normally given out to those who urgently need it first. Here are the testimonials from the patients. The patients are very grateful for receiving the bra because it helps them to boost their self-image and confidence. Olivia shared how one of the patients actually cried and said before receiving the prosthesis bra, she could only use a normal bra and she had to put cloth and sponge inside her bra to give her the shape of the breast. And now that she has got the right bra, she's very, very grateful for the sponsorship because it allows her, it gives her the confidence, it allows her to go out confidently. Olivia and her team, the patient navigation team, is very grateful and very thankful to Later Day Sense Charities who sponsored these bras for this group of patients. Olivia also mentioned, because of this sponsorship, this group of breast cancer patients can go on to lead a life like a normal woman, because being able to wear a correct bra has given them the confidence they need to live in the society today. They can go out with confidence and not feel shy. So, as you know, we are a non-profit organization. This work was possible because of research grants and donations. So do check out our website through this QR code to learn more about the work we do and learn how you can join forces with us to create a future free from the fear of cancer. If you would like to donate and to give donations like how Later Day Sense has done, Later Day Sense Charities, please get in touch with us. We'll be happy to work with you. Okay, we truly value your feedback. So if you got any feedback about this webinar, you want to hear more topics, please scan this QR code and give us your feedback. I would like to see how I can improve my presentation as well. Just going to leave this for a minute here before I change the slide. So we have the Terry Fox Run Malacca 2024 happening this weekend. Registration is still open. If you would like to register, please register with a donation of, I think, 40 ringgit, you get a t-shirt. It is happening in Malacca River Cruise this weekend. It's a friendly 3.5 km run. Okay, do join us. This is how you can fundraise for us, and this is how you can support us. Thank you, everyone. I'm going to open up the floor for a 5 minutes Q&A session. Okay, I think the first question is berapa harga bra breast, and I think Miss Mahes has already answered. Would you like to answer the question, Mahes?
Yes. Hi everyone. So okay, the price of the bra is depending on, you know, the size, what the cup is, and sometimes if let's say your cup size is bigger, then you can actually imagine the silicone would be bigger than a A cup, B cup, C cup. There's variety of it, right? So that's why the range of the price is different. So when you are buying post mastectomy bra, it comes together with the silicone prosthesis and also the bra. So the price range is 1,300 to 3,000.
Thanks, Mahes. I noticed there are some of you who put up your hands. If you have any questions, please drop your questions in the Q&A box because I'm unable to allow you to talk. Let me see if I can turn on the... Yes, just drop this.
Deciding, they have decided to go for surgery. When you are planning to buy the bra and the prosthesis, it can be something that you have spoken to your doctors so that they will actually inform you what are the processes, because it will take some time, right, for you to even purchase. So you can actually start looking for the source where you can buy. And sometimes there are going to be subsidized bra through the non-profit organizations. So most probably talking to the nurses in the clinic or the doctors in the clinic can actually help you to see where you can get the bra in a subsidized price.
There's another question, Ms. Mahes. Sekiranya saya nak guna cara JPA, berapa kali boleh saya dapat bantuan ini?
Okay, so every bra, setiap satu bra dia ada dia punya shelf life ataupun dia punya riwayat hidup. So selalunya dalam 1 hingga 2 tahun. Depend. Kalau Puan boleh jaga bra dan juga silikon tu bagus dengan cara penyimpanan, dengan cara macam mana Puan boleh simpan dia sebagai dalam bentuk yang asas, maksudnya boleh simpan dalam 2 tahun. So setiap kali JPA saya rasa boleh buat setiap 2 tahun. Depends. First one bila apply, mungkin the second time bila nak dapatkan JPA punya bantuan balik, mungkin boleh dapatkan memo daripada doktor yang mengatakan bra dan prosesis yang sebelum ni 2 tahun yang lepas mungkin sudah rosak dan perlu untuk pembelian baru. Yang itu boleh dibincangkan dengan doktor dan mungkin buat application tu biar ada memo dengan untuk yang kedua. Betul, Olivia? Dalam melalui JPA boleh dapatkan pembelian yang kedua
Ya, boleh. 2 tahun macam tu
2
lah.
tahun sekali. Okey.
Okay, thank you. Thanks, Ms. Mahes and Olivia. Is there any other questions before we close the call? Okay, one of the questions that I have been receiving when you register for the webinar is, would I get CPD points? We do not give out CPD points, but we will give out a certificate of attendance for everyone who's attending this webinar today. Okay, it will come through your email. Thank you. Is there any other questions? Anyone?
I think Zia and Veronica actually raised angkat
Yeah.
tangan. Kalau boleh, boleh tak type dekat dalam chat box
Yes.
supaya kami
in the chat.
boleh tahu apa soalan yang Puan nak tanya.
Or maybe they accidentally, because sometimes even they accidentally put up their hands. Yeah, but please drop your questions in the chat box or in the question and answer box and we can
Yeah.
help you there. There's no response from them. Maybe they accidentally put up their hands. Okay, so if there is no other questions, I would like to thank everyone who has attended, has given their time and attended this webinar today. I would also like to extend my thanks to the PNP team, Ms. Mahes and Ms. Olivia, for your time and to answer all these questions and to share it out with everyone who's hearing here today. So thank you, everyone. Okay, sorry, we have got one question. Berapa lama chemotherapy? Do you want to answer this, Mahes, Ms. Mahes?
Berapa lama? Okey. Puan Rafika ya, tanya berapa lama kemoterapi. Selalunya selepas dapat diagnosis untuk kanser, selalunya doktor akan buat plan perancangan untuk bagi tahu dengan pesakit berapa dia punya pusingan. Selalunya 6 pusingan. 6 pusingan setiap 3 minggu. Tapi ia semua bergantung kepada apa yang doktor akan syorkan. Tapi secara asasnya kemoterapi selalu diberi untuk 6 pusingan dalam frekuensi 3 minggu sekali.
Okay, thank you, Ms. Mahes. I hope Ms. Rafika's answer has been answered. Okay. Any other questions before we close the call? Ada apa-apa lagi soalan sebelum kita tutup sesi ini? Let's give it a minute before I close the call. I still see some participants who put up their hands. Miss Sarani nak cakap ke? Boleh unmute dan cakap? I think you had a question, you raised up your hand. And Miss Fetsia, you can unmute and talk. If there's a question or if you've accidentally put up your hand, then it's fine.
Puan Sarani boleh tekan ada satu ikon yang warna merah yang berbentuk mic. Bila tekan dekat situ, Puan Sarani boleh bercakap. Sama juga dengan Puan Fetsia.
Ataupun kalau boleh type di tempat chat soalan.
Maybe they're extremely productive in their hands.
Yeah.
Okay. All right. Just give it a minute before I close off the session. Okay, thank you everyone. We are now officially closing off the session. Thank you for joining us today. Thank you, Ms. Mahes, and thanks, Ms. Olivia.
Thank you, Vishala.
Thank you, Visala.
Thank you.